My name is Adam Pursoon. This is the danger of prescription drug advertising. The words of war on drugs conjure up images and emotions related to our perceptions of despondent users, military-style enforcement actions, and overloaded prison systems. The focus on illegal drugs has led to many of society's growing problems associated with prescription drugs to be largely ignored. The problems include prescription drug abuse, the large growth in the number of people who are using legal prescription medications. Technically, the abuse of prescription drugs is part of the war on drugs, but the scale and effects of the problem has been slow to be recognized by our society due to aspects of these drugs being legal, as well as the societal demographics of users. One of the main contributing factors to the increase in the number of legal prescriptions is direct-to-consumer advertising, which changed in 1997 when the FDA rules regarding advertising policy loosened regulations on the type of information that could be included in drug advertisements. To be clear, direct-to-consumer advertising does not include medical journal advertising, which is also increasing, but which targets a different market to seek to educate physicians about new drug treatments. Since 1997, spending on pharmaceutical advertising has increased sixfold, growing by about 15% annually since 1997. The success of these marketing strategies are also reflected in Americans' prescription drug expenditures, which have tripled since 1997 and reached $300.3 billion in 2009. Direct-to-consumer advertising is banned in most developed countries and should be the focus of the current war on drugs in this country. The reason direct-to-consumer advertising is banned in many countries and should be banned here is that it instills the notion of health care as a product to be purchased by informed, empowered consumers rather than a service bestowed upon a patient. This approach was particularly effective at increasing the use of antidepressant medications because there are currently no medical tests to identify biological indicators of affective disorder. Thus, prescription of antidepressant medication relies on patients' self-reported symptoms. In other words, if advertisers can convince a potential patient that they can benefit from an antidepressant medication, they can influence the consumer's request of prescription for something they just may be exhibiting symptoms of. Advertising to consumers seeks to increase usage of prescription medications among the middle-class population who can afford the medications but may not actually need them. There are several ways it seeks to do this. None of these are related to the actual effectiveness of the drug. First, the ad tries to involve emotion. Advertising does this by including non-propositional content, images, music, or other things in advertising that persuade but cannot be judged true or false in the same way that statements or propositions can. And evaluative conditioning. Creation of favorable attitude to an object by repeatedly pairing it with something that elicits positive feelings. For an example, companies advertising a consumer product are often pairing the product with images of attractive, smiling people. Consumers who have an emotional tie to the product are less likely to make rational decisions about their use of the drug and to overlook important product information, and instead focus on inappropriate reasons to use a product, such as fear, anticipated regret for not using the product, or expectations of happiness if they do not use the product. A second method advertising uses to try to increase usage is describes the application of a medical model to previously non-medical phenomena, described as disease-mongering, or broadening the boundaries of treatable illness to expand the potential market for a particular product. Advertisers can accomplish this in part by creating the impression that both the disorder and medication's use are common. This is done by presenting numbers about use of the medicine, such as X medicine has been prescribed over X number of times, or X medicine is the most prescribed medicine for X disorder. As with any other advertising, making the consumer feel use of the product among their peers is accepted and widespread makes them more likely to use it themselves. Third, the advertisers use techniques that get consumers to identify with the characters in the ads or with the description of the disorders. There are a couple of techniques that are broadly used here. One is the use of characters with emotion that the consumer can identify with and focus on inappropriate reasons to use a product, such as fear, anticipated regret for not using the product, or expectations of happiness if they do use the product. The other technique is to provide a checklist of symptoms in the advertising. Usually, these lists focus on mild symptoms that are common, but try to give the impression that left untreated, these will lead to a serious disease. These checklists give the consumer the illusion that the self-assessment lies within the realm of normative behavior, a perception which is likely to guide consumers' subsequent actions. In reality, only doctors can diagnose depression, so the use of a checklist is somewhat misleading and possibly unethical. The effect of this practice is to diminish the physician's role in the medicalization process by enhancing the role of pharmaceutical companies and consumers. The fact of the matter is that there is very little good served by direct-to-consumer advertising, and probably much harm that results. People who do not really need the drug are targeted by advertising simply because they have the means to afford it. People who need the drug may not be targeted at all. The U.S. Food and Drug Administration recognizes the threat to accurate communication posed by non-propositional content and direct-to-consumer advertising of prescription medications. In TV commercials, it limits the use of distracting imagery when adverse effects are read. In print advertising, it bans signaling effects, where the benefit information put in a headline has more impact than the risks buried in the small print. The FDA is even conducting research on how direct-to-consumer advertising of prescription medications impacts on unconscious or implicit attitudes. In conclusion, direct-to-consumer advertising should be banned in the United States because it is proven to directly boost prescription sales and ingestion by using information not related directly to the performance of the drug. More drugs are sold because of direct-to-consumer advertising, but there is little to no health benefits to consumers.